Okay, so here's the gua sha routine for those 3 triangles of the neck and jaw that we're going to treat for beauty and pain relief. So we're starting at the sternum, and again we're going to keep this flat angle between 45 degrees and 15 degrees. We're going to try to scrape gently but firmly enough that you can feel a little bit of texture through your hand with a stone. So you might be able to feel a little bit of tiny little bumps or crunchy parts. It might turn a little bit pink when you're on the chest or the back. That's okay. If you're on the side of the neck, go a little bit lighter if it's starting to turn pink, okay? So here we go. We're going to brush under the collarbone out to across the pectoralis muscle to where you meet your shoulder. So brushing across, brushing across, brushing across. Now we can also hug the top of the collarbone here with another angle like this. So we're going to press down on the collarbone, not into the tissue above it. Just pressing down onto the collarbone here. You can see a white line because it's going right over the bone. This is where a lot of the attachments of the larger neck muscles are. And it's really important to maintain fluidity and flexibility in that area. And a very efficient place to work anytime you want to treat a whole muscle is very efficient to work on the attachments of where the muscle attaches onto a bone or a ligament. Okay, so there's that. Next up, we can go across the neck up to the ear. So we're going to anchor and protect your throat, protect your trachea by putting a guiding hand here. And now we're just going to, and I like to actually start with, we're going to use a long edge here. Instead of just placing it straight back and trying to move back like that, it doesn't really work with our shoulder mechanics. So start here, but then we're going to flip this in a counterintuitive way. But then when you move it back, it's much easier on a wrist and elbow. So we're going to sweep back and up to the ear. Back and up under the ear. And you can gather some tissue under the occipital line behind your ear too, here. So we're actually going to be flicking up under the occipital line. So this is one nice big move, sweeping across and up. Now, we've landed here. Now we're going to come down. So thinking of this area here, sweep down across the top of the shoulder. Down across the top of the shoulder. And with this one, you can use a broad surface. If it's feeling really tight, you can use these little pressure point bumps. So you can come straight down like this and really kind of dig into the top of it a little bit more. Like that. And for the top of the shoulder, you can also come straight back up. So you can come up this way. So that encompasses this triangle. So that sets you up for being able to mobilize your shoulder, for being able to open this part of your neck more easily. And now we're going to go into the back. So I like to avoid the spine just for safety. If you can actually do gua sha over the spine itself, but you have to be really careful. So I'm going to avoid that for the purpose of this particular tutorial. So you're going to use this edge, cover your spine with your hand, sweep up. We're sweeping up along the side of the spine closest to the hand that's holding the tool. Now we move our hands about an inch over from there and start that, going up, again, into the occipital line. And if your back of your skull here is really tight, it might be hard to tell where the bone actually is. It might just feel like a really big area of tension. So you can just sweep up into your hairline and keep going up. And when you're going up in your hairline, you can actually do a little movement that's flicking, and it's supposed to help vibrate the tissue between like your neck and your scalp. So coming up here, flick, here, flick, flick. Or you can do a quick vibration. Like that. So oftentimes with videos online, you might see people just kind of go like this. Like, that doesn't really do anything. You have to do more vigorously in order to actually create the effect, which is vibrating the tissue underneath. When you do that, and it's effective, oftentimes you can actually feel relaxation go over your scalp to your forehead. That's when you know that you've done that successfully. If that doesn't happen, that's okay. It might just mean that you have more stagnation and tension in that area. And if you do that over time, you'll probably get that response eventually. So that was going up. Now we're going to go down, similar to this part, but we're going to angle it more from the back toward the front, if that makes sense. So when we did this one, we're kind of trying to aim along the top of that big shoulder muscle. Now we're going to try to angle this way, like imagine poking towards the center of your body, like coming straight through, like a 45-degree angle from the back to the front. So coming down here, I found a different knot right here on the back. So I'm pressing towards the front, from the back towards the front. So the angle of pressure is from the back towards the front, but the movement is just down and towards your shoulder. So we're moving the stone outward, but the pressure is this way. Okay. And then back to the area where your neck meets your back. I'm just going to come straight across, straight across, straight across. So that covers a lot of area for your shoulder, and that's usually about as far as we can treat ourselves on our back comfortably. It's really productive when we're treating neck and jaw tension to actually treat the whole back. So I would see an acupuncturist to continue the gua sha treatment for your back, or a massage therapist with accurate gua sha training could do so too. Now, the last area is going to be the temple, ear, and jaw. So we'll come back and do this at the end. So the temple, jaw, chin. Okay, so we're going to start actually by doing 3 lines under the jaw, across the jaw. So underneath, on the corner of the jaw, and then across the top of the jaw. And this tool has a couple little bumps so it can hug underneath the bone, catch the corner a little bit so you can see coming under. And I try to come all the way back onto the neck. Under, under, And with this one, start light, and then you can go a little bit deeper, and you will feel crunchy parts to this. The flatter angle is better again. Now, angling towards the corner of the jaw, corner of the jaw. And now actually I like to use a flatter part of the stone for this part. Actually gonna really press directly along the front of the jaw, and you can even hook down onto it a little bit. This is the real area that will help with the jaw pain. The underneath zone will help a little bit more with the lymphatic work and the neck, not only tightening, but also neck tension. Tightening and lifting the neck tissue. This one. And lymph. This corner one, we're actually helping to stimulate the jaw bone itself, because jaw bones do decrease in density and size as we age. So this will help just slow that process a little bit. And then finally, coming across the front, this is where a lot of these muscle connections are to this big jaw muscle here, the masseter. And then this is also where a lot of the beginnings of jowls can occur. So we want to reinforce the connection here and stimulate the connective tissue so that it bounces back. And with this area, if you are feeling like there's any looseness here, just re-anchor your skin as you go along. So anchor here, bring here, anchor, continue, re-anchor, continue, anchor. So you're just following up. And now we can come straight down the front of the ear onto the neck. Lightly, lightly, lightly. This is an area that we want to stimulate super gently, because a lot of lymphatic movement is stimulated by sweeping outward along the front of the jaw and under the jaw. And it dumps into the bigger lymphatic vessel here. So we also decrease the number of lymphatic vessels as we age. So we have to get more out of each vessel as we get older. So we're just encouraging movement. We're not squeezing it through the tube, but we are moving fluid in general to encourage lymphatic movement. So this is not technically a lymphatic drainage massage, but it is encouraging that movement through the vessels. So then you can also do little movements like this behind the ear. Smaller movements. I imagine this one, it's kind of like when you're scratching a cat's chin. Just gently scratching down. Or a dog's chin. Or a dog's ears. Scratching behind the dog's ears. And then you can also go up again. Vibrate that area and then flick upward to really encourage the tissue itself to move and jostle around. So now we're actually going to come to the front of the jaw muscle. So we're sweeping here and then really imagining and feeling, literally, the front of the jaw muscle. And instead of just pressing in like this, we actually want to directionally angle back towards the ear. So we want to find the front edge of the jaw muscle and press back towards the ear. I'm hooking in the front of the jaw muscle. And I can feel the pressure actually going into my ear because it's tight. And I can feel the inside of my ear actually relaxing a little bit when I'm pressing here. Now we're going up the edge of the jaw muscle until you meet the cheekbone. And that is a very important point for lifting the face. So this is used as an acupuncture point for lifting the face. Angled up diagonally toward your temples, So we're finding the front of the masseter, front of the jaw muscle, hooking in and angling up under the cheekbone. And we're just holding it gently. Now we're just going to continue the movement of a gentle sweep across. So it's a combination of stimulating the intersection of the bone and tendon with a stronger pressure, whether it's scraping along a bone or doing pressure underneath it, and then doing soft, smooth movements across the bigger surface area of the skin. Now, finally, to complete the triangle, we're going to go up into the temple. So we're going to actually start in the hairline and sweep back like this with a flicking movement again, so it can help to vibrate the scalp. Okay, now we're going to anchor at the side of the eyebrow and sweep back. Anchor and sweep. Anchor and sweep. And you can do a lot of the work in this area to help with wrinkles, or you can do the same thing for crow's feet, that type of thing. But really basically just anchoring and then sweeping across gently. This is when specialized serums come into play. So I learned from Dr. Zhang with Nefeli is the brand of her serums. And I found them to be really effective for helping to stimulate the skin, help with reducing wrinkles, fine lines, and then the last thing is the secret weapon is actually pearl powder. So if you have fine lines in a particular area, or if you have textured skin, then you want to just dab a little bit of pure pearl powder over it, put your oil over top of it or a serum, and then oil, and then use a gua sha. And that, to me, is the most effective treatment for reducing that. But that's for another time. So this is just the movement that we want to work on. So coming up here into the temple, flicking up. You can go all the way from your ear up to the corner of the head. You can do the whole hairline, actually. The whole scalp is actually incredibly important for facial rejuvenation. But this is just the apex of the triangle we're working on. And then we come down. You can follow the curve of the ear down back to this behind the ear point, like scratching your dog or cat's ears, and coming down again. Then we can join in with this triangle. You either go back this way, or you can come back up this way, or back up this way. So then you can just become really conversant in those fluid movements that encourage the muscle relaxation and fascia opening for that whole area. So now my right side is more lifted than my left side, so I have to go and do the left side now. But this has been the explanatory version of that. And for the left side, I'm just going to do it silently. So it'll be a shorter routine that you can follow along with. Thank you.